You already saw in there, you get a pen light, BP cuff, and a stethoscope, and a blanket. I don't see my pen light.
It's in the room. When do you guys want to grab the blanket?
Yeah, let's see the pen light.
So this is the material you have for testing. And this is it. Everything else is verbalized, right? I tell you guys all the time. How many times have you heard me talk about verbal diarrhea?
A lot.
Hopefully I do well here. We'll see.
Okay. So this is going to be like National Registry skills testing, like we covered. We have a blood pressure cuff, stethoscope, pen light. You're going to voice treat all life threats that you find, anything that you cannot obtain from the mannequin itself. Demonstrate to me how you would obtain it, such as the blood pressure, and I will give you the vital sign. For National Registry, you have 15 minutes for a medical, 10 minutes for a trauma. Let me know when you're ready to begin.
Give me just a second. And you're allowed to do this. I've got a blank piece of paper. I'm writing down on my glove. Glove's clear. I'm just making some mental notes real quick. Is that okay, sir?
That's fine.
Okay. Okay, so what I wrote on my glove, just so all of you guys know, you can do your own thing, doesn't matter. I wrote pulse, BP, respirations on my palm. TTH is the time of the hospital. My scene issues, resources, and then ABCs. Okay? That's what I do. OP, QRST, sample, all those things. Whatever you need to do, find your own way to do it. You are allowed to bring in a blank piece of paper and a writing utensil because you have to take notes. Okay? Sir, I'm ready.
Okay. It is 9 o'clock in the morning. You're dispatched for a patient with altered mental status.
Okay. 9 o'clock in the morning, patient with altered mental status. How far am I from the scene, sir?
You are 10 minutes from the scene.
10 minutes from the scene. How far from the scene to the hospital?
From the scene to the hospital is 15 minutes.
Is ALS available?
ALS is not available.
Helicopter?
Not available.
Were any other units dispatched with me to this call?
Law enforcement was dispatched because the neighbor called and said that they couldn't make entry to the house.
Okay. Do I have fire coming?
They are coming.
Okay. What type of residence am I responding to?
It's a single-story, single-family dwelling.
What part of town?
Your normal response area.
Normal response area? As I approach the scene, is there anything that stands out obvious?
Nothing.
Do I see barking dogs?
No.
Hostile crowds? Is there anyone waiting for me outside?
The neighbor's there going, she's in there, I can see her, but she won't open the door.
Is PD on scene?
PD's on scene and they're fixing to force entry now.
Fixing the force entry now. Okay? PD's there. I'm confident in this current situation. Force entry. Walk in the house. What do I see?
You walk in the house, you see a woman, she looks to be in her 70s. She's sitting in a chair in the kitchen,
Okay.
just sitting there.
Okay, real quick. Do I smell anything?
No, you don't.
Do I see anything obvious? You know, pill bottles, trash, feces. What's the house look like?
There's what looks to be like a bowl of dinner
Okay.
sitting on the table, half eaten.
Okay.
That's it.
As I walk in, does she track me?
She does not.
Ma'am.
She looks up at you, kind of confused as you say ma'am.
Okay, as I'm doing this, I'm grabbing her radial pulse. Do I feel a radial pulse?
She does have a radial pulse. It is 68 week, regular.
68 week. What about skin color, temp?
Her skin is pale, dry.
Pale and dry. Ma'am, as I'm talking to her, I'm looking at her airway. Do I see anything obvious?
You don't see anything obvious, and she just kind of mumbles.
Okay, is she breathing?
She is breathing. It's 18. It's non-labor.
I want to ask the neighbor if she knows anything about this woman.
Yeah, I spend all day with her usually.
Do you know any of her medical history? Anything she might be diagnosed with? Any medication she takes?
She's got diabetes. She's got a heart problem. She had a heart attack 2 years ago. They think she had some mini strokes, I think they called it.
Okay. As I'm getting that information.
Her medications are, you asked about were metformin,
Okay.
lisinopril,
Okay.
and baby aspirin.
Okay, as I'm doing all this, I'm going to demonstrate the BP, but I want my partner to be getting this. So BP.
And blood pressure is 118 over 64.
Okay. I'm going to ask my partner to get a BGL.
BGL is 95.
BGL is 95. As I'm looking at her, I'm going to check her pupils. What do I see?
Equal, round, reactive to light.
What's that?
Equal, round, reactive to light.
Okay. Is she able to follow any commands at all?
Um,
Ma'am,
she-
can you squeeze my fingers?
She does, and you notice that the right side is really weak.
What about bilateral pulses?
They're equal bilaterally.
Okay. Ma'am, can you give me a smile?
You notice some facial droop on the right side.
Facial droop
Maybe a
on the
little
right side.
toe.
Okay. What I want to do at this time is I want to initiate transport. I want to move over the gurney, and you're going to get going to the hospital. To backtrack a little bit, I would like to dispatch ALS.
Okay.
Being 10 minutes from the scene and they're 15 minutes out.
Didn't I say they weren't available?
Oh, they weren't available? Sorry. Okay.
You asked
So no
me.
ALS, cool. Let's initiate transport. As I'm doing that, I want to put her on some oxygen. What's her O2 saturation?
Oxygen saturation on root air is 93%.
93%. Do I have capnography available?
You do?
I want to put her on capnography, nasal cannula cap for right now.
Okay.
What do I get?
Capnography is 34.
34. Load her up into the truck. Let's get going and route to the hospital. I'll position her in a position of comfort. As we're doing that, I'm also going to do kind of a quick head to toe. I want to look and see if I see anything obvious, any injuries. I'm going to start at the head. Do I see her feel anything, like she may have fallen?
You don't see her feel anything like she's fallen.
Okay, is she more alert, less alert?
She just still can't, she tries to mumble and respond to you, but really can't get words out.
I really can't get words out. Okay. Now that I'm in the back of the truck, it's a little quieter. I want to get breath sounds.
Clear, 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 clear.
Okay. Finish my quick head to toe, just looking, see if her abdomen's soft, non-tender.
Abdomen is soft.
Is her pelvis stable?
Pelvis is stable.
Gonna kind of work my way down to have equal pulses.
Present.
Cool. At this point, I'm suspecting possible TIA. BP is still a little low for that, but she is altered. Checked her BGL. Her BGL is within normal limits. All I want to do at this point is continue to monitor her ABCs and reassess and route.
Okay. How often would you reassess?
Every 3 to 5 minutes for this patient.
Okay.
At this point, would you like me to give a radio report?
That's fine.
So, which was, you know,
They said she was in her 70s. No, we never gave a definitive age.
UNMH, this is CNN Medic 1.
Go ahead.
Be advised, we're en route to your facility with a 70-ish-year-old female. Call came in as altered mental status. She was unable to answer the door. Patient is alert to verbal more than anything right now. I have her on oxygen via nasal cannula. Vitals for the most part are well within normal limits. I don't have anything jumping out at me. Patient does have a history of TIAs, and that's what I'm suspecting right now. She does have right-sided facial droop as well as right-sided weakness. I have her resting comfortably on the gurney. We'll be at your facility in 5 minutes. Do you have any questions or orders?
No questions or orders. See you in 5.
That'll be terminates my. So now